My name is Professor Allyson Pollock. I'm a Professor of Public Health Policy and Research, and I work at Queen Mary University of London. I'm in Bath to give a lecture tonight on the abolition of the National Health Service.
Because that's something that, for example, Liberal Democrats and Conservatives will say is just a misnomer. It's just the commissioning that's changing, not the health service itself, that is still going to be the same principles as it was founded after World War II.
Well, we have to go back to the founding legislation of the National Health Service, and the founding legislation imposes a duty on the Secretary of State for Health to secure and provide comprehensive healthcare for all citizens throughout England. It's that duty that has now been abolished. So there is no longer a duty, a ministerial duty, to secure and provide universal healthcare for all. And the government has passed a major Act of Parliament which abolishes the NHS, and it has 457 pages. And the reason why it needed the 457 pages, because in addition to abolishing the NHS, it's now moving towards a full market in healthcare. So it's breaking up the NHS and bringing in private commercial providers who will increasingly have the ability to determine who gets care and what services will be provided.
Now, for many people, they'll say, well, actually, my GP service, the service in hospital, is just the same as it's always been at the moment.
For a while it will be, because there's still over £110 billion of funds coming into NHS-funded services. But what's happening is that the English NHS is being remodelled along American lines, so that the NHS will simply be a payment stream which is flowing to a variety of private for-profit providers.
So where will the signs start to appear of this US-style system coming in here in Britain?
Initially, what patients will find is that they may find some of their GP practices closing, and so that it's increasingly more difficult to get a general practitioner, especially in the inner city areas. But on top of that, they may find that increasingly some services will no longer be available provided by the NHS, and these are likely to be a range of community services. So there will be a reduction in the provision of things like occupational therapy, physiotherapy and speech therapy services. But in addition to that, they may find it harder and harder to get the treatments that they need, such as elective surgery for hips or for cataracts.
Now, I know some of the basic services, things like, for example, hernia operations, have already been privatised. They're being done by private health providers like Care UK, for example. How are those services, as they're delivered, different to the old NHS? Is there really any difference?
Well, there are two key differences. One is that the private for-profit sector has cherry-picked the healthy patients and the profitable services, leaving the sick and the unwell and the vulnerable and the elderly for the NHS to pick up, which means that the NHS is left with the higher risk patients. Now, this has two effects. One, it destabilises NHS hospitals, and secondly, it has an impact on the training and education of staff. But the third thing to remember is if you go into a private for-profit hospital, they don't have all the backup that's needed should you fall critically ill or sick. So if there are complications, if you know you need to go to intensive care, then you simply are whisked back into the NHS for your treatment again. So in fact, the private for-profit sector is protected from all the risks and costs of care, and the government is picking up all the litigation and all the liabilities.
So is there any real prospect of preserving the old-fashioned NHS, which was, after all, put together after World War II, when people realised if you're dragging an injured body out of a bombed building in the Blitz, then you really don't want to be asking too many questions about how much you can pay. You just want to get that person better.
This is a political decision. The government in England has made a decision that it no longer wants to afford a national health service. And it also has made a political decision to change the basis of funding, because when it took away the duty on the Secretary of State to secure and provide universal healthcare for all, it opened up the prospect of raising funds from out-of-pocket payments, user charges, and also private health insurance. So private providers in a marketplace want to have the ability to ration NHS-funded care and introduce new charges for treatments. So what will happen is you come into hospital, they'll offer you a small range of treatments that are available on the NHS, and then they'll begin to offer you a whole range of other treatments that you can pay if you're willing and able to pay. This is deeply inequitable, and it creates a multi-tier system and a race to the bottom, and it's very, very then difficult to monitor whether the care that you're getting is actually the care that you need, and it breaks with public trust. But the most important thing to remember is that it's not because we can't afford it. We're still one of the richest countries in the world. We absolutely can afford it. The government has made a decision that we should no longer have a national health service, and that's a political decision it's made. The second myth that we're always told is that we've got an ageing population. Now, this is true. We have got an increasing number of older people, but report after report after report has shown this is not the catastrophe that the politicians like to say it is. Far from it. If you keep older people healthy and well and they live longer, then they are not a drain on the National Health Service. Indeed, most of the costs of healthcare are incurred in the last 6 months of your life. So if you die when you're 15 or 30 or 45 or 70, the costs are in the last 6 months of your life and not as a result of being simply older. So there are a lot of myths. We do not have this demographic time bomb that the government talks about, and we absolutely can afford it. And it's a needless scandal that the government has abolished the NHS when actually it's a very, very vital bit of our social contract of what people feel means to be British.
Also, the US, you're saying we're going down this line, it's worth looking over the United States at problems with their system because they may be arriving here soon. What sort of problems are there in the US? Well,
the government is remodelling the National Health Service in England along US lines. Now, in the US, there are 60 million people without any access to health care. That is the equivalent of the whole population of England. And 2/3 of all bankruptcies are due to medical healthcare bills. People don't make any decisions in their lives about changing jobs in case it affects their healthcare status. And it's quite catastrophic. It's also the most expensive system in the world, so it takes 18% of gross domestic product compared with our system, which is between 8 and 9% of GDP. So what we're going to have is enormous inefficiencies. We're going to get over-treatment and under-treatment, overcharging, and billing and invoicing and marketing and all the costs that come with a market that are not associated with a public healthcare system. It's grossly inefficient, the American healthcare system, and it's the most unfair and most inequitable system in the whole of the Western world. I've worked on NHS privatisation for over 20 years. I've written a book called NHS PLC, The Privatisation of Our Healthcare. All my work has been on the Private Finance Initiative. It's been difficult work because for a long time, nobody, especially the politicians, didn't actually like the analysis or want to believe the analysis, especially when New Labour was in power. So that was particularly difficult to get the work published and out in the public domain. But now we've come to a really critical stage where the NHS has now been abolished and there are campaigns all over the country mobilising. So I'm sad to say that my analysis of 20 years has been proven right. May the 7th is a very important day because the Care Bill goes back to the House of Lords and there are a number of very critical amendments to do with hospital closures, but also to do what's happening to patient data. Because one of the problems is that for 60 years, we have given our data to doctors and health professionals in trust that it will be the confidentiality will be respected and it won't be sold on or commercially exploited. So for 60 years, the government has taken great care of our data and it's only used for planning and research and needs assessment. Now what's happened over the last 10 years, but since the Health and Social Care Act, is that increasingly the government sees data as an income stream, an asset to be traded in the marketplace. And what's actually happening is that our patient data are being commercialised and they're being sold on and sold off to big companies without our consent and without our knowledge. So because of this, the British Medical Association, Med Confidential and the Royal College of GPs have had a big campaign saying we need to opt out of the new system where the government wanted to collect all the GP data and bring it together and link it to hospital data. Patients were being told that they should opt out. Now, because the government was worried about losing the data, it's actually paused this new system called care.data and promised to bring forward new amendments. We've seen the government pause before during the passage of the Health and Social Care Bill 2 years ago, when actually they did nothing to alleviate our concerns. And now what we see is during this pause, they've tabled an amendment which is next to useless. So myself and a number of colleagues have put together 3 amendments which should go into the Care Bill and which could be used to safeguard patient data and restore public trust. But if the government does not accept these amendments, then we are into a very critical situation where our data, which will increasingly be in the hands of private companies, because when you go to a private company for your NHS treatment, they receive your data and they can pass it on and parcel it on. What we need is checks on them being able to do anything that will commercially exploit our data, because the data that's generated between the patient and doctor is a very special piece of data and information. It's generated in trust. It's when we're at our most vulnerable that we give our data, and actually it's when we tell all the secrets. So it's very, very different from data, for example, that goes to supermarkets, for example. So I think it's very important that people are aware of the care.data, they're aware of the issues, and that actually we need a year to get this right. We must get the legislation right, but in the meanwhile, we need to stop the commercial for-profit sector from extracting our data and use it for marketing and targeting and commercial purposes, which could ultimately also result in the denial of some of us getting a denial of care.
They're saying that this will be all anonymised.
Well, there are 2 issues. Data can have all the identifiers stripped off them, as in national statistics, and they're aggregate and anonymised. But when you want to link different data sets, you have to strip off the identifiers, but you still need to be able to have what's called pseudo-identifiers to link them. It is actually possible using what's called pseudo-anonymised data to identify individuals. Now, that's very, very worrying, especially as we're moving into a marketplace where the private sector will want to target us for goods and services that we may not need. So they will be very interested in whether we can afford to pay, for example, and whether they can actually target us and use marketing methods. Now, that's something that's never happened in the National Health Service. But a second real risk is that private sector is risk averse. So they will want to limit their risks, which means that they will want to limit the amount of care they give us. And those data, again, will be used to identify high-risk groups such as the elderly, vulnerable people, people with mental health problems. They want to target them so that they can begin to either restrict their liability for care and offer either private treatments or reduce the availability of care so that they don't have to have responsibility for patients. And this is a very well-known tactic. It happens all the time in the US. So it's not a conspiracy. It's just business. It's just the way business works.
Where can people go if they want to do something about this? Because I think many people, if not all our listeners, probably want to keep the National Health Service. How can we do that?
Well, there are a number of very important things that people can do to protect and defend the National Health Service. The first is to write to their MPs. MPs hate getting letters from the constituents, especially when they're critical of the destruction of the National Health Service. So they must do that. And they must, in that letter, demand that the Health and Social Care Act, which abolishes the NHS, is repealed and the duty to secure and provide healthcare for all throughout England is restored. Scotland and Wales both still have a National Health Service. Only England has gone down this route. And it's really vital that we restore that duty to secure and provide healthcare for all. So the MPs are very important. The second target is to join campaigns like Keep Our NHS Public or 38 Degrees, to mobilise in every way and to oppose every single hospital and service closure.